Hello, my name is Edwin Ramos, and today I'll be presenting a proposal for diabetic patient education training. First of all, let's talk about what is diabetes. Diabetes is a condition in which the body does not properly process food for use as an energy. Most of the food that we eat is turned into glucose, which is sugar. The pancreas is an organ that makes a hormone called insulin to help glucose get into the cells. Diabetes when your body cannot make enough insulin, or the body doesn't know how to use the insulin. This can cause for you to have buildup of glucose in your bloodstream. Untreated diabetes can cause for you to have many side effects, including glaucoma, amputation. It can even lead to death. This is why diabetes education plays an important role in the management and prevention of diabetes mellitus type 2. The purpose of this proposal is to develop and validate a training program for patients with diabetes mellitus ranging in the age of 55 and over. This training will create empowerment in each patient to improve and take control of their diabetes. Studies have shown that type 2 diabetes is the 7th leading cause of death in the United States alone. This is a study done by the American Diabetes Association. Effective prevention and education can decrease and delay further complications associated with diabetes mellitus type 2. Therefore, it's vital to create a training program that will provide education for those patients suffering from diabetes mellitus type 2. Awareness and education are the key to prevent decrease further development of this chronic illness. Currently, diabetes education is a widely unused resource. In this training program, the clinical staff will have 3 sections to learn which this is 3 sections. The first one is the basics of diabetes mellitus type 2, which is understanding the true meaning of diabetes, and that is crucial for the patient because this information can give the patient understanding and knowledge of what diabetes is and the risk factors and what can happen if it's not controlled or treated. The second one is living with diabetes. This section can provide guidance to the patient to change their lifestyle, such as eating healthy habits, doing exercise, and provide them with the comfort that this disease is easy to live with, even if it's a really disease that can be controlled, and you can live with it for a long time if it's treated and controlled. The third one is the ABC of diabetes, which stands for A is for hemoglobin A1C. That's the glucose level on your blood. B is for blood pressure, and C is for the cholesterol. These 3 things are 3 things you need to manage when you have diabetes, and you have to have knowledge regarding these 3 things. And lastly, the clinical staff will have to emphasize the importance of the 3 sessions and master their skills and knowledge to educate and train the patients accordingly. Effective diabetes care management programs aim to change the lifestyle of the patients, as well as provide support networks such as counseling, education, and training programs. In conclusion, diabetes mellitus type 2 is a chronic and very lethal disease that can lead to death. Diabetes requires much time and effort to be managed properly on a daily basis. Taking part of a diabetes education program that will address the importance of a lifestyle changes and proper self-management is recommended for all patients with diabetes. This training program can be the beginning of a better care treatment for patients who are struggling with this disease.